Hey guys, Mitch here. I just had my first session done with the New Eyes laser in Barcelona, Spain with Dr. Grimaldo's. This is the laser to change your eye color cosmetically. So it took us a 14-hour plane ride to get here. I'm from San Francisco in the US. My mom rented us an apartment for the 2 weeks that I'm going to be here. It takes 9 days to complete the treatment if you want to do it in one session. I opted for one session because I really didn't want to take the time off of school and work again to come back. You do have to get another follow-up appointment in about 6 months to make sure everything's going okay. But I wanted to, try and condense it into as much time as possible in just like one session so I don't have to come back as much and take that time off of work. Getting to the office today was pretty easy. My mom rented us an apartment in kind of the outskirts suburbs of Barcelona, and it took us less than 30 minutes to get to the doctor's office. The doctor's office is located it's kind of downtown, like kind of above the Les Ramblas, which is a tourist attraction here in Barcelona. And when you go to the doctor's office, it's not really clear, like the number is clearly marked, but it doesn't really say like Dr. Grimaldo's New Eyes Laser. It's just like a center for specialists, and you go up to the second floor, US second floor, or it would be European first floor. So not the ground floor, just like upstairs. And when we went there, the medical assistants didn't really speak English, but they were really friendly, and we got through it. We showed up about an hour early because we didn't know how long it would take us to get there, and we needed to get money out of the bank. If you're going to do this procedure, I would definitely recommend having your euros ready to go before you get over here, because with the banks, with American banks, they're always like, it's just a big hassle. They always want you to like do all these things before you come over, and then when you come over, the exchange rate is much better once you get into Barcelona for the euros, but it's also a really big hassle of like having to call your bank and get them remove all those credit limits. I actually called my bank and told them I was going to be traveling here for 2 weeks, and they still put a block on my credit card when I tried to get money out of the ATM. So I would definitely just get it at the airport, get it before you leave. That way there's like no complications once you get over here. So we got the money and we went back to the office. We sat down. It was 3 o'clock on the dot, and the office opened back up, and Dr. Grimaldo's wasn't there yet. So we just sat down and tried to be, patient. I've heard in Spain that usually people run a little bit late, and that's pretty common. So he showed up around 3:30, and my appointment was, I think, the first of the afternoon. So when he came, he called us up. We went in, and after that, some other patients started arriving. When I first started researching this procedure, I was really skeptical about whether it was just like a scam, because I had heard about other procedures like this and they were not legitimate or they were really risky. So I did do a lot of research, and I looked up some videos. Of course, on YouTube there are videos, but the only videos I've seen about this procedure were in Spanish. So I actually watched them in Spanish and tried to, understand what I could understand. And I looked into his background. He had spoken at a conference here in Europe for ophthalmologists, which is pretty renowned. And after doing a lot of research and actually looking at like his prior patients and looking at all the procedures that had been done, I figured that it was worth the risk to me to come over here and actually try to get the procedure done. So after I went in, he explained and went through my medical history. He's going to ask you about your family history, whether you have any systemic disorders like diabetes, or if you have any eye surgery or any eye problems in your family like glaucoma or macular degeneration. The big one that he seemed to stress was glaucoma. He said that even if you don't have glaucoma, if there's someone in your family in that has glaucoma, and if you have that gene, that it could be really bad for this procedure. So when they do the procedure, they basically have your eye and your cornea, and they take your iris and he burns off with the laser. He like burns off your perimeter and like the first layer of pigment in your eye, and that pigment in your eye doesn't just like fly off your eye and just like disappear into nowhere. It's actually those little like color particles are actually going through your body's drainage system, and with glaucoma, the pressure in your eye is too high, so the drainage won't actually work that well. So after going through all of that, he just wanted to really make sure that was no one in my family had glaucoma. I wish he would. I wish there had been stressed like more on the internet, in the documents that I had looked at, and more during the telephone conversation, because I think it's important to know under what conditions you wouldn't be a good candidate for the surgery before you actually spend all the money to get over here. Because for me, half the cost of the surgery is actually buying the plane ticket to come over here, and the hotel stay or the apartment stay is more than half the expenses. So if I were to know that before, and if I hadn't been a candidate then and get here, because it would be really bad to come all the way here to Barcelona, and obviously if you come all the way here from the U.S. or abroad, you really want to have the procedure done, and then to have him start going through your medical history and be like, oh, someone in your family has glaucoma, oh, we can't do this, or oh, you had this type of eye surgery, we really can't do this procedure for you. So I'm glad that I was a candidate, and we went through, and I had to sign the medical release and ask for like my passport number, and we went through all of those steps. His English is really good, even though his medical assistants didn't really speak English. His English is really good. It's like almost perfect, especially when he's speaking to you. When we were asking questions, I brought my mom along. I don't know if it was he didn't understand our questions, or it was just his personality to where you had to be really direct in asking your questions. My mom and I are from California, so especially when we're speaking amongst ourselves, we use a lot of slang. So my mom was kind of talking in the same manner to him, because since his English was so good speaking to us, maybe because we were using a lot of slang that he didn't understand, didn't exactly understand like our clarifying questions. Like even though he had said it, he would just repeat the same thing versus us saying like, "You've said this. Is this what you meant?" kind of thing. So when you go to ask him questions, if you're speaking in English, I would just to make sure to be really direct and speak very standard formal English, because I think that would be the best way that the communication is going to be more clear for you and for him. He did an eye exam with me, and my eyes were normal. I see really well out of my right eye, and my left eye I don't see so well out of, and so he decided he was going to do my right eye first. Pressure was normal in both eyes, and he was going to do my right eye first, which is the eye I used to pretty much see out of. So once he put the anesthetic drops in my eyes started watering and feeling dry. I started to get a little headache around my eye. Nothing too bad. It was definitely tolerable, but a little bit uncomfortable. Then we actually went to the pharmacy to get some drops. You have to be on like a pretty strict drop and medication regimen for the first 5 hours after each session. There's usually 4 sessions, which he does one eye, does the perimeter of the iris, then he'll do the other eye perimeter of the iris, then the middle of the iris, and then the middle of the iris. So it's 4 total sessions. Each session is like 2 days apart. So today I had my first session, it's Tuesday. Tomorrow I have to go in at 11. He's going to check up on me and see how my eye is doing, and if the procedure was good for me, and see if we can proceed to the other eye. He also had me send him a message about how my eye was doing after the procedure, and he said he would change the treatment regimen if I were to have a bad reaction 2 hours after the procedure. He gave me some more medication that I could take, or he said I would have to come in and be seen today if things didn't go well. Everything went fine for me, and during the procedure, you just have to look really straight ahead and like look at this red light, and you have to tap if you want him to stop. And it seemed like maybe I was being a little bit sensitive because he said the procedure usually takes 10 minutes. For me, it felt like it only took like 5 minutes, but it didn't feel bad. It just felt like a little bit of pressure on your eye. It felt fine. It wasn't painful, except for the headache I had like around my eye. I didn't have any pain directly like on my eye. My eye just felt really dry and I wanted to blink it all the time. So like every 30 seconds I was like tapping and being like, stop, you have to stop because I need to blink my eye. And I guess I was moving around a little bit. My eye was moving around a little bit, even though I was trying to really just focus and stay like not moving and doing what he's saying. It was really hard for me. So I guess that was a little bit sensitive, or I'm a little bit sensitive. So I think if I can stand it and I'm really sensitive, I need to blink my eye every 30 seconds over like a 10-minute procedure, I think that everybody else should be okay with it. And after the procedure, the headache around my right eye started getting like pretty intense. It wasn't like full on like I'm gonna die, but it was definitely like I want to take some pain medication and I want to lay down. He said for the first 6 hours you cannot lay down. You have to stay like upright, either walking or sitting. So my mom and I basically walked home to our apartment from the office, and because my left eye doesn't see so well and I was closing my right eye, I was having a hard time like seeing, and I actually bumped into my mom a couple times. So definitely if you're thinking about going sightseeing afterward, if you're sensitive like me and you have one eye that you don't see so well out of, you might want to, bring your glasses if you have them. I don't have glasses because my right eye is really good, and I usually use that one to see. That when they're both open, I can see them fine. And after the procedure, there was kind of this like brown film, like if you were to put the setting on your camera, sepia. So it's kind of like this brown film. I could see completely clearly. It was like kind of brown. And for the first couple hours, it was like that. And he said it's supposed to get better and stuff is supposed to be blurry. My eye was not blurry at all, just like had that kind of brown tinge. So that was a little bit annoying, but I'm 6 hours after the procedure now with my right eye. I can see completely normal. No discomfort. The headache started going away after about 4 hours, and you have to put these 2 drops every hour for the first 5 hours. So you put the one kind of drop in, and then you wait 5 minutes to put the other kind of drop in. You do that on the hour for the first like 5 or 6 hours, and then you also take like some ibuprofen, and they seem like pretty standard drops. For me, like I don't like having stuff in my eye. They stung a little bit. I never put eye drops in my eyes. My eyes are usually like perfectly fine, so they did sting a little bit, like very mild. So that was the only thing that is kind of like annoying to me, and having to stay straight up. Like with that headache, I really just wanted to lay down. So we just like came home and I was just like sitting upright, like with my eyes closed, just being like this for like the first 2 or 3 hours. So I did look in the mirror, and I do see definitely some change on my right eye compared to my left eye. My eyes are a grade 2 on his scale of how dark your eyes are. So that's pretty light, and my procedure overall is supposed to cost 2,000 euros. So on the website I know it said like 3,000 to 6,000. So I don't know, depending on how light your eyes are, if he charges less if your eyes are lighter because you need like less time. So that might be something to ask during your first email exchanges, because I'm pleasantly surprised that it was actually a lot less. I budgeted like at least like not. You say 3 to 6, and I kind of like want to like I'll budget like $4,000. So I'm glad that it was actually a lot less than I had anticipated. Sorry about the lighting. It is night here, but I wanted to give you guys my initial thoughts on how the procedure went, because I'm sure I'm going to have a different view tomorrow and I'm going to start forgetting things pretty rapidly. I will put in some photos of my eye, the before and after right here. I will do another update after my checkup with Dr. Grimal's tomorrow at 11. So you guys can get my initial impression and also going through the treatment. And I hope this is helpful for anyone who's considering having this procedure done or is just, interested in learning more about it. And I will talk to you guys soon. Bye!